Gripped with sharp, worsening abdominal pain, the sufferer is carried off at once to the hospital, where they are diagnosed with appendicitis, operated upon immediately, and their appendix removed. After a few weeks of recovery, they are deemed cured. To all intents and purposes, a completely healthy individual, minus, of course, their appendix, a so-called vestigial organ, which, as they have been led to believe, served no real useful purpose in the body, and which they are probably better off without. It all sounds beautifully simple and straightforward, doesn't it? We have a normal, healthy individual carrying around an appendix given by nature, which may at any time, for some unknown reason, gets blocked, inflamed, and infected as bacteria multiplies inside. One day, quite without any previous warning, they suddenly get a violent pain in their side, sees a doctor, is told they have appendicitis, is operated upon, the offending appendix is triumphantly removed, and in a few weeks are out and about again in far better health than before. This appendicitis somehow is not connected to the fact that for years the person in question has been constipated and have been in the habit of taking purges and laxatives, and that for some months before the attack they had been unable to obtain a bowel movement for days at a stretch. Sometime later, when the patient returns home, they will again face chronic stubborn constipation. Minus, however, their appendix, which, far from being a useless appendage left in the body after evolution as once believed, is a most useful little organ, playing a very important part in the work of the large intestine, and by its oily secretion helping to prevent and allay the very condition of constipation, which must now of a certainty become worse. The appendix is not a useless part of our anatomy. Appendicitis is not a disease liable to attack any and everyone without rhyme or reason, or to be randomly infected by some invading virus or bacteria. The body is not better off without an appendix than with one. Appendicitis never appears except in the wake of chronic bowel trouble, and is really inflammation of the appendix due to the accumulation of toxins and effete waste matter in the colon and cecum, which the system is piling up there every day through the medium of the food eaten, which it is unable to evacuate. Often in cases of appendicitis, surgery is just as suppressive and harmful in its effects upon the future health of the individual as any of the other methods employed in orthodox medical practice, because it removes the superficial symptoms of disease, only to allow the real cause of the trouble to continue unchecked and become more deep-rooted than before, whilst the trusting patient fondly imagines that his or her sufferings are now over once and for all. Now, in the full light of our knowledge as to the true effects upon the health of the community of the blessings of surgery, think of the thousands having tonsils and appendices removed. In Ontario alone, 14,000 tonsillectomies are performed and 25,000 appendectomies are done across Canada each year. Let us turn to the other side of the picture and see what would have happened if a naturopath was called instead of the medical doctor. In the first place, instead of putting it down to some virus or bacteria, the naturopath would have known at once the real cause of the attack, being the many years of bowel trouble and/or constipation. The patient would be put on a complete fast, and the pain relieved by the application of hot and cold packs to the affected area. After a day or two of this treatment, the condition would have so improved that a water enema could be used with good effect, and the clogging contents of the bowel removed. And in a week or so from that time, still being kept on water and fruit juices only, her appendicitis would have completely disappeared. Note the difference between the two methods of treatment. The patient would have been left with their appendix intact, the bowel thoroughly cleansed and ready to work properly after its enforced rest accomplished by fasting and a change in diet. The appetite now keen and healthy, so that, being put on a sensible diet, they would have been well on the way towards renewed health and vigor. Instead of which, having trusted orthodox medicine, they now have no appendix, are more constipated than before, probably continuing their old habits of living and eating, which must inevitably lead to further and yet further trouble.